My name is Dr. Casilda Balmaceda from New York Neurological Consultants. Today we will start a series of lectures talking about pain and pain management and how to avoid and reduce pain in natural medicine and using natural products. First of all, I would like to start telling you about some common problems that occur in pain, such as joint problems. Let's talk first a bit about repetitive joint injury. For example, you can have somebody who runs a lot or who has an injury from cooking a lot, develops carpal tunnel, tenosynovitis. That is a type of pain that we call a pain related to repetitive pain injury, repetitive joint injury. Number two, we can have pain syndromes caused from trauma. Let's say a car accident or a work injury or a fall. That is a type of pain that is very severe and again is called trauma-related pain. The third pain that we have is pain related to arthritis. There are two types of arthritis that we commonly see in our practice. One of them is rheumatoid arthritis and the other one is osteoarthritis. One of the most important types of arthritis is osteoarthritis, which occurs in joints such as the hip, the knee, the shoulder, etc. The risk factors for osteoarthritis are weight, severe weight gain, weight issues, and also immobility. That's why I tell my patients it's very important to move every day and to keep your joints in a very healthy condition. What happens in osteoarthritis? First of all, their weight actually leads to loss of cartilage, which actually protects both areas of the bone. The cartilage actually cushions, if you will, the bone areas. Number two, after the joint is damaged by the loss of cartilage, there is inflammation. There are bone changes such as bone spurs, bone cysts, or also many areas of bone damage called osteophytes. After that, there is an area of inflammation that comes. Inflammatory substances, really white blood cells, red blood cells, leukocynes, all these substances go inside the joint cavity. Fluid is accumulated, and the joint inflammation process is what gives you pain. Let's discuss a little bit about what happens in the process of inflammation of a joint. First of all, there is damage to the joint, whereas you can damage it from a fall, as I mentioned, from a repetitive joint injury, or you can have damage from rheumatoid arthritis, which is a hereditary condition, or you can have damage from osteoarthritis, which is caused by damage to the joint, led by weight, lack of use, etc. First of all, fluid gets into the joint space. So fluid actually gets trapped into the joint space. And then because there's so much fluid, less nutrients get to the joint itself. So the cells of the joint get starved of food, of nutrients. After that, there's an accumulation of a lot of inflammatory substances, including white cells, substances like leukotrienes, etc. And that is called the process of inflammation that we try to alleviate when we use natural medications for the relief of pain. What is the purpose of nutrition and well-being to prevent pain and to alleviate pain and to help joint pain? Well, first of all, nutrition is important and natural medications are important because it leads to healthy living. It's very important to know that one of the main risk factors in prevention of injury is weight control, cardiovascular disease control, and mobility issues and mobility improvement. So it's very important that we work on our weight stability and we work on mobility. Second of all, how can natural medicine help joint health? Well, let's go back to ancient medicine. That actually is the origin of natural medicine. Ayurvedic medicine dates back to 5,000 years ago, back in the Hindu countries, and they emphasize actually a lot of very good health with respect to balance of different elements that leads to alleviation of pain. One of the main ingredients that the ancient Hindus use in pain relief is curcumin. Now, curcumin is one of the extras that we're going to be talking about, which is one of the products that actually helps alleviate chronic and acute pain. We'll be talking about three very important natural products that have ancient bases that actually help reduce inflammation and joint pain. One of them is curcumin, the other one is OPC3, and the third one is bromelain. Curcumin is an active ingredient in turmeric. Many of you may have actually seen the turmeric in spices. Curcumin has been used, as I said before, for about 5,000 years in Ayurvedic medicine to help relieve inflammation and pain. So it is considered a natural medication for centuries. One of the main properties of curcumin is its anti-inflammatory property. And remember, we talked about inflammation and how can inflammation and decrease of inflammation alleviate joint pain. Curcumin has a very important anti-inflammatory property which reduces joint inflammation and hence decreases pain related to joint inflammation. The way that curcumin does this is that it actually inhibits two very important enzymes in inflammation, cyclooxygenase and lipoxygenase. These are very, very important enzymes that cause inflammation. So curcumin helps chronic pain that has been present for weeks to months to year. The benefits of curcumin also are particularly beneficial in women and also in men with prostate problems or men with history of prostatic hypertrophy or men with problems with prostate cancer. Why? Curcumin actually causes and helps and enhances the balance of hormones that actually increase our awareness of pain. So curcumin reestablishes that natural balance that makes us not perceive pain as strongly as before. So curcumin is particularly helpful, as I said, in people with chronic pain, chronic joint damage, women who may be postmenopausal or who may have some hormonal problems, and men with prostate problems. The dose of curcumin is 400 micrograms a day taken in one single tablet. The second product we will talk about is OPC3. OPC3 is a very interesting and active product because it has several ingredients that not only promote joint health and alleviate pain, but also help with protecting your heart and all your cardiovascular risk factors. One of the ingredients that OPC3 has is pycnogenol. Pycnogenol is derived from the bark of a pine tree. Pycnogenol is extremely important in also reducing pain and joint inflammation, as was discussed before. The additional benefit of OPC3 is that it has red wine extract and bilberry extract, among other things, and those extracts are extremely important in promoting your endothelial health. The endovascular health and the endothelial health is the health of your blood vessels, particularly if you're a diabetic, if you have high blood pressure, if you have high cholesterol, you may have increased risk factors for heart attacks, carotid problems, strokes, etc. So one of the ingredients in OPC3, several of the ingredients in OPC3 promote your cardiovascular health.